And it goes a little something like. You are summer and after.
So, we are going to talk about fecal analysis. So, what is fecal analysis? It is a test that is done on a stool sample to help diagnose certain conditions affecting the digestive tract. This includes the infection such as from parasite, bacteria, viruses, and fungi. Also includes the malabsorption, inflammation, and cancer. So this is performed with a combination of X-ray, physical examination, blood work, and endoscopy to confirm the conditions. So there is some indications of fecal analysis. Those are first is aid in diagnosing disorder related to gastrointestinal bleeding. Second is to help diagnose suspected inflammatory bowel syndrome. Third is to identify the cause of diarrhea of the unknown origin. Fourth is to investigate disorder of protein digestion. Fifth, screen for colon cancer. Six is to determine the intestinal parasite infestation. And lastly, it evaluates the effectiveness of therapeutic regimen for intestinal malabsorption.
My name is Anna Rose Ebora from BSN 1Y2-16, and I'm here to discuss the stool collection procedure and what to instruct the patient for stool collection. So, in preparation, make sure that the patient will not taking any alcohol, aspirin, vitamin C, or ibuprofen before the fecalysis test or during the routine fecalysis test, because these substances may alter the result of the test. The second is the patient must also urinate before collecting the stool sample to prevent urine from mixing the collected sample. So, in the collection, before you begin the specimen collection, you will need a few things. A stool sample container on the laboratory, a pair of gloves, a clean bedpan or plastic container. These things you will need in the procedure. The first one is to prevent toilet water from contaminating the stool sample. It is important to defecate on a clean, dry bedpan or plastic container. Second is collect parts of the stool that contain blood or mucus and put it in the small container provided. The sample should at least be peanut size or of your thumbnail at most. And third is label the container with the patient's full name as well as the date and the time of collection. So after collection, it is important to submit the stool sample to the laboratory as soon as possible. This urgency is because some parasites, especially those found in watery stool samples, may be difficult to find after 30 minutes has passed.
The tool examination test contains two parts, which is macroscopic examination and microscopic examination. Macroscopic examination starts with the medical technologist observing the stool's characteristics using the naked eye. The medical technologist records the color and consistency of the stool, whether or not it contains mucus, and if the color is either brown, green, black, or red. The medical technologist further notes the consistency as either firm, hard, soft, or watery. Microscopic examination. This examination uses a portion of stool mixed with normal saline solution. Place a drop of normal saline on a labeled glass slide. Using an applicator stick, transfer a small portion of the stool and mix well with the saline. Place a drop of cover slip on the top of slide and examine immediately using the microscope. The medical technologist then looks for the following: parasites, cells such as RBC, WBC, or fat, harmful bacteria, and mucus threads.
Each lab is a different range for what's normal. Your lab report should show the range that your lab uses for each test. The normal range is just guide. Your doctor will also look at your result based on your age, health, and other factors. A value that isn't in the normal range may still be normal for you. A stool analysis test result usually take at least 1 to 3 days. The result of fecalysis is normal when the stool appears brown, soft, and form inconsistency. It does not contain blood, mucus, harmful bacteria, viruses, fungi, or parasites. The result of the fecalysis is abnormal when the stool appears black, red, white, yellow, or green, and the stool is liquid or very hard. It also abnormal when the stool contains blood, mucus, harmful bacteria, viruses, fungi, or parasites, and the stool contains low level of enzymes such as trypsin or elastase.